Hi, I'm Dr. Boen and welcome to our webinar series. So let's go ahead and look at the 2022 predictions in cosmetic dermatology. So what's new? In this lecture, I'll be talking about some of the latest treatments that just became available and some new and trending treatments that will be available later this year or early 2022. So let's see, what do we have in store? So everyone's been asking about this. There is a longer lasting neuromodulator, which a neuromodulator is something we call a Botox, Xeomin, Dysport, Jeuveau. So I'll talk about that. There is an injectable cellulite treatment, which is the first injectable cellulite treatment on the market. We'll talk about some new fillers that are just available, a novel device for tattoos and cellulite, and the trend, which is combination treatments. So what is the newest Botox on the block? So there is a new Botox coming out. It's called Daxi. However, the new name is still pending. And so there's been a lot of clinical trials with this new neuromodulator. It is supposed to last about 6 months. So keep in mind that the current neuromodulators, Botox, Dysport, Jeuveau, Xeomin, last about 3 to 4 months. However, in these studies, Daxi botulinum toxin A has been shown to last 6 months, so almost twice as long. Why does this new neuromodulator last so long? It's because of a novel peptide formulation. So let's look a little closer at this graph. So this was a clinical trial that compared Daxi to placebo. And as you can see, the peak effect is 2 to 4 weeks, similar to Botox brand. However, if you look at the 6-month mark, which is right about here, you still have between 30 to 40% efficacy. And with the neuromodulators currently on the market, usually that effect has waned more. And it's a little bit here. And now some photos about how it lasts. So this was tested in the glabellar complex or the 11 lines. And as you can see in baseline, it's very strong. At week 4, at maximum contraction, still no wrinkling. At week 16, maybe a little bit's coming back. And about 6 months later, we have a little bit more movement, but still better than baseline. The same can be seen here. And there are some phase 2 studies that are now looking at Daxi for the forehead lines and crow's feet, and also showing similar longevity, about 6 months before we're getting a little bit closer to baseline movement. And there also was a head-to-head trial between Daxi and the Botox brand. And this was 40 units of Daxi in the frown lines. And let's go a little bit closer here to look at some of the graphs. So as you can see, there's 2 doses of Daxi used. So I'll look at the green one, which is the 40 units. And they compared that to 20 units of Botox. And I know the units are a little bit different between the neuromodulators. But as you can see, about at the 6-month line, you still have reduced movement with the new Daxi neuromodulator versus the Botox brand, which is more of between a 10 to 20% movement here. And similar onset though, between 2 to 4 weeks is when you see peak effect. So this is very exciting for patients because everyone is asking that. People love Botox, people love the neuromodulators to help reduce the muscle movement, help reduce 11 lines, forehead lines, and crow's feet. The problem is people just wish it lasted longer. And so this new neuromodulator could be a game changer in the fact that you need less treatments less often. So what's up next? So the other new injection that came out just this year, and our clinic was one of the first ones to get it, is Quo, which is the first injectable for cellulite. And this is a purified enzyme called collagenase, which is used for other medical disorders, and it breaks down the fibrous septate of cellulite. So let's go a little bit more into cellulite causes. So cellulite is very prevalent. About 90% of women have cellulite. So I wouldn't call this a disorder. This is just a condition that is more common in females due to the anatomy. So cellulite is caused by these fibrous bands, which are over here, that tether the skin and the fat together, causing a dimpling appearance. And excess fat and skin laxity can also contribute to the appearance of cellulite. And so collagenase uses an enzyme to basically enzymatically cut these bands and release them. And it usually is about 3 treatments. And we actually did the clinical trials at our site. So I was able to be, I used this product in the clinical trials about 2 years ago. So familiar with how to use it. And it's about 3 treatments. Each dimple is marked and then injected with Quo. Some of the side effects though are you will get bruising afterwards. That goes away, and some swelling. And it's usually between 25 to 50% effective after 3 treatments. So these are some images from the clinical trials that were also performed at our clinic. And as you can see, this was injected into the buttocks area, and the dimpling has improved after 3 treatments. And even though the patients have bruising, this all goes away. So it's a pretty good result for just injectable medication. And so there are other cellulite treatments on the market. So I wanted to compare these for you guys and see how Quo stacks up to the other ones. And I wrote about this a few years ago about just in general, the treatments available for cellulite. So Quo is the only injectable for cellulite, has minimal downtime. The other ones on the market are Sulfina, which is a controlled subcision. So it is a little bit more downtime. The area has to be numbed with tumescent fluid, and a special device goes in to untether the fibrous bands using a subcision blade. So a little bit more downtime. Other ways to improve cellulite are biostimulatory fillers that can also address the skin laxity associated cellulite. So there's various methods to treat cellulite, and luckily more recently there are many more treatments available for us to help patients. So now RHA fillers. So RHA fillers just came out a few months ago. However, they've been in Europe for several years. They've recently have been introduced in the US, but these are not new. They've been used in Europe for several years. And so the difference between these RHA fillers and other fillers maybe we're familiar with, such as Juvederm, Voluma, Restylane, Belotero, are that these fillers are useful for areas of motion. So they are cross-linked using a new technology to add flexibility to these fillers. So they're very soft and gentle and give a very gentle and natural hydration of the skin. So they're very useful around the mouth. And just to add a little bit of volume along the jawline as well, because these are areas of motion. So this is an example of where I injected RHA fillers in the perioral area. So a little bit over here in the oral commissures or corners of the mouth to lift it up, and a little bit in the lips to give support and structure as we lose support and structure in the lips due to the aging process. And a little bit here in the marionette lines as well to reduce the shadowing effects and volume loss that occurs. And these are a few little angles too, but I really love to do the RHA fillers in the lower face and perioral area because they're great for areas of motion. And this is another one, also great for the smile lines. They hydrate the areas. When you smile, it doesn't look lumpy. It integrates well in the tissue. And I'll also add a little bit in the cheeks as well to lift the skin. And this is another angle just showing the nice improvement of the smile lines with these new RHA fillers. And they integrate very well into the tissue. And so Resonic is our next device that is coming actually in a month. And our clinic is one of the first sites to have it. And this is a non-invasive device that emits basically controlled shock waves. So the device looks like this. This emits very controlled shock waves, so nothing, no cutting of the skin. These highly focused sound waves go under the skin to address their target tissue, and you can use it to improve cellulite appearance and also to treat tattoos. So how does it improve tattoos? So basically we use our picosecond laser, and afterwards we use a Resonic device to break up more of the pigment. And then we're able to then use the laser again. So you can more pass through the laser. And from clinical studies, this is kind of hot off the press. This one was treated just with a Q-switch laser, and this area was treated with a Q-switch and Resonic laser with more laser passes. This is control, and as you can see, the Resonic treated area with the laser responded better. So this is kind of like the newest thing in laser technology, and we're very excited to try it out in the clinic and hopefully help decrease the amount of tattoo treatments needed. And for cellulite, how it works, cellulite, it's going to be one treatment. It's about 30 minutes. You can do the buttocks and the thighs, and it breaks up those fiber spans we were talking about. And the shockwaves go under the skin, so there's no cutting, no injections, unlike Quo or Selfina, for example. Okay, and then lastly, we do this very frequently, but it's very trendy now to do combination treatments. So after a year at home in Zoom, patients want to have multiple treatments on the same day to address their aesthetic concerns. For instance, sometimes we'll use different lasers to address the red spots, red vessels on the face, brown spots, and skin texture, because it's hard for one laser to do it all. And you can safely use most of these lasers on the same day. And we have over 40 lasers, so we're able to treat your various concerns with the lasers on the same day. But lasers can't do everything. So sometimes you need some volume enhancement or wrinkle reduction with Botox and fillers. And with some lasers, you can actually do these on the same day. So it saves a lot of time for patients. And if you're going to have the downtime, it's better to do it kind of all in one treatment versus spacing it out and returning multiple times to have the different lasers or cosmetic treatments performed. And so this is a little video of a patient undergoing multiple lasers and filler treatments on the same day. So here I'm using the Pico-Way laser to treat these patients' brown spots and go over these individually. Then I switch over to the Pico-Way Resonic laser to treat texture and background hyperpigmentation. I also use the clear rolling laser for this effect as well. And then just another example using the Pico-Way Resonic for texture and browns. And this is a great laser for skin application. And now afterwards, I'm doing a little bit of RHA filler for the marionette lines. And this is immediately after. So as you can see, we have a little crusting of these browns and a little redness from the laser. And using a little cannula here so for bruising reduction. And you can see these have filled in nicely. So these are kind of the new things that are coming out in cosmetic dermatology. A new Botox, some new fillers available, a lot of new cellulite treatments and combination treatments. And this is me at Big Bear on a vacation with my baby, which is more, not so much a vacation as a trip with a baby.
Thank you so much, Dr. Butterwick. Oh my gosh, Dr. Boen, sorry. You. That was great. It's so exciting to think about all the procedures that are coming soon will be right around the corner. So at this
Absolutely.
time, if you guys would like, if anyone has any questions, please put them in the Q&A feature on Zoom, or if you're calling in, you can chat them if you can. And I have a couple questions ready to go. If you're ready, Dr. Boen.
Sure.
All right. So this is an interesting question of where can QWO be injected? Can it be injected into the arms?
So currently, it is only approved for the buttocks area, and you can also inject it into the cellulite on the thighs. However, it has not been studied for the arms, so we have not been injecting it there.
Got it. And talk to us more about Daxi. Is
Sure. I'm
3
gonna go
times
back to
the
the
amount
slides.
of Daxi needed versus Botox?
This is like a big thing. Is it actually the dosage of Daxi that is causing the, the better effects? So Botox is dose dependent. So Botox, Xeomin, and Dysport are dose dependent. So the higher doses you do use, the longer it lasts. And there are studies currently out using like double the dose of Botox in the frown lines to see if it can last as long as Daxi. So that is still coming out. But anecdotally, even treating a very high dose Botox in the frown lines, it may still not last the 6 months of Daxi. However, those studies really kind of looking if the high dose Botox Dysport Xeomin are being studied currently to see if they can match the Daxi. So that is still pending, but I haven't seen it so far where even a high dose can last for 6 months.
So interesting. It will be very interesting to see. Do you have any idea when it might be coming out?
So I just talked to the company and they're thinking it's maybe sometime in the fall. And then I also just want to, there were few side effects in the Daxi trial. So it was actually very safe. Less than 1% had like very less than 1% had maybe like a little brow drooping, but otherwise it had a very good safety profile as well for the Daxi.
Wow. Okay. And how about for the masseters? I know Botox generally lasts longer there. So will Daxi last even longer?
It could. It hasn't been studied for the masseters yet. Currently, they started with the 11 lines, and there's phase 2 studies for the forehead and crow's lines. But it would be interesting to note if it would maybe last even longer than maybe a year in the masseters, because the masseters last a little bit longer than other areas.
So interesting. And so, do you know yet, is Daxi going to be more expensive?
I've been asking. They may price it a little bit more because it's a little bit more units than Botox. But there's the secret is still unknown. Yeah, they're
So
keeping
we
it
don't know
top
exactly.
secret.
Okay, yes, this is the future. And like you said before, we don't even really know what it's going to be called. Daxi is just what
You
we're
don't
calling
know.
it.
Yeah, Daxi just kind of what everyone is calling it so far, but we're still waiting for the final name.
Okay, exciting. And for everyone tuning in, you'll definitely be the first to know. Okay, someone's asking, what is the masseters? What are masseters?
So masseters are one of the 3 muscles of for biting and eating, and so it contributes to sometimes TMJ issues or clenching of the teeth, and it can also widen the jaw. So we can inject a little bit of Botox into the masseters to relax them, and it does slim the face. And it has also been used for patients who have problems with clenching the teeth.
Yes, and I can personally attest it is the best kept secret, I think.
It
It
is,
totally
and
slims
not.
my face, and I'm actually hoping Dr. Boen can treat mine today, and if she can, we'll go live so you can watch it live on our Instagram.
Sure. And then I just posted too on my Instagram an example of doing a young patient doing her masseters to help slim the face as well. And a lot of people don't know you can also use Botox on the lower face, which we do frequently. So for instance, on the chin, we have the dimpling chin. It elongates the chin, makes it a little bit smoother. And we can also do the platysmal bands, which are these little bands on the neck that pull the neck down. So we're doing a lot more with Botox than people think. It's more than just for the 11s, crows, and forehead lines. It can do a lot more for you.
Yes. And in a previous live, when Dr. Boen did my Botox, she did my gummy smile too, which is another little fun trick that Dr. Boen has up her sleeve. All right. So back to cellulite. So how long does the Quo treatment last? Is it permanent?
So the Quo treatment is a very quick in-office treatment. We circle the cellulite dimples, and then it's just a few injections. And so far, it's been lasting. The bands have not been reforming once they've been enzymatically degraded by the collagenase in Quo. So we have about 2 or 3 year data now for this new injectable medication. And it's actually been on the market. It's been used for other medical conditions that have too much collagen. So it's actually been on the market for other things as well.
All right. And with the Resonic, with the laser tattoo removal, can you talk more about how you think that's going to change the game at all compared to what we're doing now with the combination of 3 lasers?
I think we're going to have to do a tat 4 then. It's going to be 4 things to help out with the laser for tattoo removal. And the tattoos, it's tough because now it's 5 to 7 treatments. So anything that will help kind of speed up the treatment for patients, I think will be appreciated. So I'm excited to try it out in a month in our clinic to see if we can speed up that tattoo removal for patients.
Beautiful. And you spoke a little bit about combination treatments. How about, and you talked about combining the lasers together. How about combining injectables and lasers? Can you do them on the same day? Do you do them separately?
Yes, and then so this one you have to have a little bit more experience kind of with the fillers and injectables and lasers to do them on the same day. But we've been doing this for a while where you can usually, depending on the laser, have your Botox and laser on the same day. It has to just be in a very specific order. And then certain fillers you can do on the same day as lasers too, so that you don't have to, you can have one downtime versus coming in over and over again and having a lot of downtime for these lasers.
All right. And how about combining some of these lasers with any of Farzane's esthetician treatments, like, you know, doing microderm or hydrofacial or something before or after? Do you recommend? Have any recommendations?
Sure. Usually for those, I would maybe if we're doing like any like hydrofacials, I would probably maybe space those out a little bit. Like if there's like a hydrofacial and a peel, maybe wait a week or 2 in between. Just because sometimes there's a little redness that may affect the laser in that sense.
Got it. All right. Beautiful. Well, if anyone else have any questions, this is the time. If not, back to 2022, I wonder, you know, it'll be really exciting to see these new fillers coming out and the new Botox coming out and cellulite treatments and everything like that. So we will definitely have them all first. And as Dr. Boen said, because we've been doing research on most of these treatments for years now, we actually have a lot of experience and we will be the first to offer them, most likely the first in San Diego, if not even more in Southern California.
Yeah, no, I think it's a really exciting time in cosmetic dermatology. A lot of new things are coming and they're safe and effective. And I'm excited to try them all out.
All right, great. And I guess before we leave you guys, I just want to state that if any of this sounds interesting, of course, Dr. Boen or any of our board certified dermatologists are available for consultations. Dr. Boen offers complimentary consultations, virtual, in person, or we also offered paid video consults and the payment goes towards treatments. So no matter where you are in the country, you can definitely have her give you a personalized recommendation and treatment plan. And I also want to let you know that it is such an exciting time for cosmetic dermatology, like you alluded to, that we are actually booking out pretty far. So I encourage you, if you want to book even for the summer, get yourselves on the schedule soon because we're booking. I mean, people are right now booking into August. So want to make sure that you guys get in when you need to. So please don't be worried about calling ahead and booking months out for yourself so you get your spot on the schedule.
Cool. Yeah. Well, thank you guys all for joining my webinar. I hope you learned a little bit more about what's new and trending in cosmetic dermatology. And I look forward to seeing you guys all in clinic.
Thank you so much, Dr. Boen. Thanks everyone for tuning in. Bye.